When half of your patients are disappointed by FAI surgery, you have a serious problem on your hands. That means that the surgery is clearly not doing what it's supposed to do. In this video, we're going to talk about the success rate of surgery for hip impingement. We're going to talk about the actual science around FAI surgery success rates. We're going to look at two studies that will explain to you why hip surgeons are so confident that their surgery will work and what the science actually says. So if you're ready, let's get ready to think right, move right, and feel right. So this first study was published in 2016, and I will leave a link in the description box. Basically, they took a bunch of patients and they said, hey, we're gonna follow you and ask you questions for 2 years after you've had hip surgery to fix your FAI bone shapes and fix any labral tears or whatever else is going on in there. And so what they did was they had each patient go through a questionnaire which is called the non-arthritic hip score. So let's take a look at the non-arthritic hip score so you understand how it works. So there are 20 questions, and each of these questions is asking about your discomfort when you're doing some pretty basic things. So for example, walking on a flat surface, you have extreme pain or extreme difficulty, then you get 0 points. But if you have none, no problems at all, then you get 4 points. If you're going up or down stairs, and you have some pain and extreme difficulty, you get 0 points, but if it's a easy problem-free-ish activity, then you get 4 points. So 20 questions, maximum score on each question is 4 points. To get your total score on this questionnaire, you multiply your points by 1.25, so your maximum score is 100, right? Now, when we go back to this study, you can see that pre-operative, the mean score on the NAHS was 54.9. At 3 months is 66.6, 12 months 74.9, and 24 months 75.4. And so here they point out this was a 20.5 improvement NAHS, which isn't that amazing? All of these patients got huge improvement, 20 points. That's got to be amazing. But wait, let's do a little bit of math here. If the average score was 54.9, then we can divide that by 1.25, and we can figure out that the average answer on all of those questions was around a 2.2 at the beginning. If we then look at the actual NAHS, we can see, well, what is a 2? Well, a 2 is around moderate pain on all of these things, and maybe sometimes you did a little bit better. Maybe at night in bed it was just mild, maybe sitting and lying down it was just mild, but you know, you were at some moderate at least discomfort throughout your daily existence. So then 2 years post-surgery, the average score was around a 75. So what does that mean when we average that out across all the questions? Well, if we do the math, we find out 2 years post-surgery, the average score on these answers is a 3. So let's look at the NAHS, and what does 3 mean? 3 means you have mild discomfort doing basically all these things. Standing upright, you might still have mild. What this study shows is that after 2 years, these patients are reporting on average a slight improvement in their hip problems. They can still have mild stiffness, mild decrease in range of motion, mild catching and locking in their hip, mild pain going up and down stairs, mild whatever. If you went from moderate to mild, would you consider the surgery a smash hit success? If your answer is no, I would not consider a surgery for my hip to be a success if I still had mild hip pain after the surgery, then you and I are in the same camp. What's then very interesting to note is that 64% of patients were satisfied with their surgical outcome according to this study. The question of satisfaction is a little bit more complicated than that though, because if you don't think you have another option, then of course you're going to feel satisfied that you did the one thing that was available to you. If you talk to many surgeons, you'll find that they believe the only way to fix FAI or hip impingement pain is by doing surgery, and they'll tell you straight up your only option is hip surgery. On this topic, I'm going to link to a video down below where my friend Shane Dowd of GotRom.com interviewed somebody who was told by one of the top American hip surgeons for FAI that he had to get hip surgery to fix his problems and that he would need hip replacements by the time he was 30. After you're done watching this video, I highly encourage you to watch that interview so you understand what you are fighting with when you talk to a surgeon who seems convinced that the only way to fix your hip pain is with hip surgery. So in this first study, they've concluded that arthroscopic surgery for FAI is a good idea. It's safe and successful, despite the fact that only 64% were satisfied. That means 1 out of 3 were not happy about how things went. And despite the fact that the improvement in actual function and pain was going from moderately painful to mildly painful. So let's look at this second study, which was published in 2012. This paper looked at how expectations from the patient lined up with actual outcomes from the surgery. This is a much more straightforward way of analyzing whether or not surgery is a success, because you're asking the patient, was this successful? Did it fix your hip pain? Do you feel better walking? If your expectations are met, then obviously that's a success. If your expectations are not met, then the surgery is not a success. This study is a fabulous insight into the success rate of hip impingement surgery. They looked at 86 patients and followed up with them after surgery to see whether or not their expectations were met. Just looking at the conclusion, you can see that expectations of surgery were overly optimistic. Having one's expectations fulfilled, especially in relation to pain, was important for a good outcome. The results emphasize the benefit of assessing patient-oriented outcome in routine practice and the factors that might influence it, such that realistic expectations can be established for patients prior to surgery. I love this language because it's low-key blaming the patients for having expectations that are too high and saying that doctors in the future should try to attenuate their expectations so that they'll be happier with their crappy results. And I don't use the phrase crappy results lightly. If you scroll down to figure 1 in the full text, you will find that there is a simple graph here that tells us whether people's expectations were met by the surgery on various different metrics. The most important metric for somebody who's undergoing surgery for hip impingement is gonna be hip pain. And so on that metric, when the surgeons ask the patients, hey, were your expectations met? How do you feel? 56% of the patients did not have their expectations met for the relief of their hip pain. The other 44% had their expectations met or exceeded, but we have no idea how low their expectations were set. What we do know is that people who expected their hip pain to go away were not happy. 56% were not happy with the surgery. In terms of walking capacity, 45% were disappointed by the surgery. In terms of their ability to play sports, well, 61% were disappointed. In terms of general function, 53% were disappointed. So again, there are 2 ways to take a look at these results. You could take the stance that the problem is with the patients not having low enough expectations, or you could take the stance that maybe the expectations that surgeons are setting for what the surgery can actually do are too high and are totally unreasonable. When half of your patients are disappointed by FAI surgery, you have a serious problem on your hands. That means that the surgery is clearly not doing what it's supposed to do. The only way to argue against this is to hide the reality behind metrics like the NAHS, or there are other orthopedic questionnaires like the Harris Hip Score that purport to show you success when really they're just hiding failure. Some proponents of hip surgery for FAI might also say, well, maybe it's because the surgeons were no good in these studies. That's a fair question, but you also have to ask yourself, as somebody with hip pain, how are you going to determine whether the surgeon you're seeing is a good surgeon? I've seen and heard cases of people getting hip surgery for hip impingement and finding themselves either exactly the same or worse off. I have yet to see a high-quality study that shows that patients are really happy and satisfied with surgery for hip impingement. If you're aware of a high-quality study that actually shows really high patient satisfaction rates with FAI surgery, one that shows that people's expectations for hip pain are actually met, then please drop it in the comment section down below. I would love to see it and understand where this overconfidence in the surgery is coming from. If you are considering hip impingement surgery, I strongly encourage you to check out the links in the description box. I'm going to share interviews with people who have been told they needed surgery. I'm going to share interviews with people who were told that surgery would fix them and found out it didn't do anything for them. And I'm going to share other scientific literature to help you make an informed decision for your body. I also co-created a program to help people with the FAI diagnosis so that you can fix your hips without surgery, without pills, without injections, and without drugs. In the program, we address the muscles of the hip joint rather than obsessing over the bone shapes. You can't change the bone shapes, and based on numerous studies, the bone shapes are not even related to hip pain or the development of labral tears or arthritis. So instead of focusing on those bone shapes that are irrelevant and can't be changed, we focus on muscles which can be trained to improve function and range of motion and daily comfort. For more videos to help you understand the truth around the FAI diagnosis, check out these videos here. If you want to support more videos like this one, use the join or thanks button on YouTube or the PayPal or Patreon links you'll find in the description box. I'm Matt Chu from Upright Health, reminding you that pain sucks, life shouldn't.